This is the second video for the 12th class of the social psychological perspectives on health. In the first video, I talked about how social identification is important for group memberships to function, to work as a resource. And then I covered some studies supporting the argument, and I also explained how social identities can structure our thoughts, feelings, and behavior. And to support such argument, I introduced one study which showed that how belonging to multiple groups is related to how people understand a cause of consequences and consequently depressive symptoms. And in this video, I will continue the part. Okay. A person's moment-to-moment cognitions are shaped by social experiences and the availability of social resources. So in the cognitive behavior and attachment models, they argue that early life experiences develop underlying vulnerability to depression. So if they have some trauma in their childhood, like child abuse, that will be a source of underlying vulnerability to depression. So if they have those kinds of early life experiences, then they are more likely they are vulnerable to becoming depression. And this kind of early life experiences will manifest in maladaptive core beliefs such as I am unlovable or I will always be alone. And these models argue that such beliefs are enduring and stable. And thus, in order to change such beliefs, they need extensive therapeutic intervention. So, unless they go through extensive therapeutic intervention, patients cannot change such enduring and stable beliefs that would cause depression. And probably these models understand that because such beliefs are very enduring and stable, many people often have depression relapse because even after going through the therapeutic intervention, it is really hard to change such beliefs. However, from a social identity framework, beliefs are understood as fluid and it is social, meaning that meanings of beliefs can be changed by with whom they are. So even if they believe that they are unlovable, it the such belief depends on how they categorize themselves. Maybe they can be perceived as unlovable in one group, but they may be very much lovable in other groups. So it really depends on whether they are lovable or unlovable. And it depends on which people they focus on. And then beliefs are self-relevant because meanings and importance of beliefs can be changed based on how the self is categorized. So when from the perspective of traditional psychology, if they say self-relevant, then maybe it could indicate that beliefs are static and very in the essence. But from social identity framework, if beliefs are self-relevant, then selves can be changed at in the moment to moment, you know. Selves can be changed from context to context. Yeah, I thought I had somewhere, but anyway, so yeah, because self is very much fluid, self-relevant beliefs would be also fluid depending on how they categorize themselves. And also, from social identity framework, beliefs can be challenged by social experiences. So social experiences change a person's readiness to categorize oneself in certain ways. So for example, people could understand or categorize themselves as unlovable person, but if they have experience of being loved by someone, then their such experiences would make them so much difficult to categorize themselves as unlovable person, right? So although cognitive behavior and attachment models argue that such enduring and stable beliefs can be changed only through extensive self-examinations and therapeutic interventions, meaning that patients have to constantly ask, am I really unlovable? Or why do I think that I'm unlovable? People have to really think or see deep in themselves, and then they need a therapist help to see within themselves. But the way they see themselves is not only through categorizing themselves as individual, and then but they could define themselves using different categories, and based on each category, they can see others who share a same category. And by seeing others, they can understand who they are, because categorization really helps them to see the self and others as similar. And then by changing their categorization, they can change their beliefs about themselves. They can think themselves differently. Okay, to support such arguments, social experiences change beliefs. There is one study, and they did a study with homeless people. And the researchers asked their experience with a charitable association, such as a Salvation Army, which provides short-term accommodation services. And they asked, they asked homeless people with several questions. Okay. So first one, social isolation schema. I feel on the outside of group. So basically how isolated they feel. Okay. And I think they asked this question when they are at the service, at the short-term accommodation services. And the other one, social identification. I feel strong ties with members of this service and multiple social groups before coming to this service. I think this is okay. No, I'm not. Sorry. Before coming to this service, I was a member of lots of different groups. Okay. And the new group memberships. Since leaving the service, I have become friends with people in one or more new groups. Okay. Okay, so yeah, I guess T1 is the time when they are still at the shelter, and T1 is when they left the shelter. And there is a 3 months gap between time one and time two. And as you can see, social isolation schema at time one is positively related to social isolation schema at time two. So the more they feel isolated when they're at service, the more they feel isolated when after leaving the service. Okay, that's kind of normal. But at time one, if they belong to multiple groups, multiple social groups, then they are more likely to join new groups after leaving the service. Okay? So basically, this is like multiple groups working as bridging capital. Okay. And if the homeless people did not feel isolated at the service, then they would the such feeling isolated is negatively related with social identification. So this is a positive experience at the service. So the less they experienced isolated at the service, the more positive experiences they would have, and the such positive experiences would help them to develop strong social identification with the service. And this positive experience at the service would be positively related to the possibility or to the numbers of groups they will join. And if they belong to more groups, then they would they would feel less isolated. Okay? The positive social experiences with members of a charitable association led them to have more social experiences. Basically, they would join more groups. And then that would lead them to change their beliefs about the world in positive ways. So if they have positive experiences at the service, then they are more likely to join more groups, and then they would feel less isolated, or they would not feel on the outside of of groups. Okay, so they'll change their beliefs about the world. Also, let me delete the annotations. Self-related construct that used to be considered as fixed, such as attribution schemas and negative thinking, are structured by social identity and responsive to social intervention, such as providing people with groups they can belong to. So in this case, accommodation service or the service itself. As I said, self-related constructs were thought to be fixed, but from social identity perspective, that is very much fluid and can be changed depending on categories or groups they belong. And groups can be provided so they can change how they think about themselves and how they think about the world. So, biomedical approach to depression makes people believe that they have the underlying essence to determine the kind of person who they are, such as I am feeling depressed because I am a depressive person. So here, ironically, categorization kind of it tells that how categorization has a strong and significant impact on how they think, how they believe about themselves. So if depressed people categorize themselves as depressed person, then their thoughts and feelings would be also changed in a way that according or inconsistent with the idea of being depressed person. So, if they have if they use such categorization to define themselves, they would have more negative thoughts and they would have more negative beliefs. And it would be so much difficult to change such negative thoughts and feelings directly. But if they change the categorization through positive social experiences, then uh, changes in negative thoughts and feelings would sort of happen automatically in together with changes in categorization. Okay, so social identity approach helps people from thinking this way. Who they are can be changed by moment to moment and by with whom they categorize themselves together. So instead of categorizing themselves as depressed person, they could categorize themselves as a member of the service, as a member of the Salvation Army. By doing that, instead of thinking themselves as depressed person, they could think of themselves as someone who belonged to a positive social group or group, and that would change their negative thoughts and feelings, and thus it would change their behavior that would help them to have much better life. So in this sense, unlike biomedical approach, which makes people think that their future is fixed and probably closed, social identity approach is, I think, very much hopeful. Okay, so depression intervention are effective to the extent that they modify social identities or the social realities that inform them. So the effectiveness of cognitive behavioral therapy cannot be attributed to cognitive changes, but rather to the common factors. So in previous lectures, I explained that uh, while cognitive behavioral therapy argues that it helps patients to change their negative thoughts, which will lead to changes in feelings and behavior. Actual evidence shows that changes in their mood happens before changes in their cognitions. And effectiveness of the therapy, because of that, effectiveness of therapy is not really due to the cognitive changes, but common factors such as the quality of relationship between a therapist and patient, the amount of rapport or therapeutic alliance. So these factors may be responsible for effectiveness of various kinds of psychological interventions. So while cognitive behavioral therapy argues that they help people because they can change their cognitions, but maybe not only cognitive behavioral therapy, but many other therapies work because they have common factors, which are good relationship between therapist and patient. Well, yeah. Okay, and to support this kind of argument, there is a study, and they examine people with disadvantaged, and these people were facilitated to join a recreational group of their choice. And group types, such as like the participants were allowed to play soccer, enjoy art, play yoga, or sewing. Those group types or frequency of attendance did not predict depression severity 3 months after joining the group, but instead social identification at time two. So was the strongest predictor. So it was really important what kind of activities they do or how often they meet. But regardless of types or frequency of meeting, as long as they can develop a strong social identification with their group, then they experienced improved depressed symptoms. And furthermore, high social identifiers had a 29.6% chance of being diagnosed, while low identifiers had a 52% chance of being diagnosed as depression. So unfortunately, even if they belong to a group, if they don't identify themselves with the group, then the depression relapse would be just same as those who may not have belonged to a group. But if they can strongly identify with the group, then the depression relapse rate would go down to a half. Okay, and then study two showed similar results. So basically, they met twice a week and 3.5 hours uh, for every meeting. And they continued this for 4 weeks. And they did group-based cognitive behavior therapy. And they found that group-based cognitive behavior therapy was effective overall, but the therapy was more effective for high identifiers. And those highly identified with the cognitive behavior therapy group had a 32.6% chance, while low identifiers had a 50% chance of being diagnosed as depression. So again, if they even if they belong to a group, if they cannot identify with a group, then the depression rate is as it may be in like individual therapy. But if they can strongly identify with a group, then the depression relapse rate was much, much lower. Okay, so again, I think the key point here is that it's not really the status or yes, no of group belonging. So it doesn't matter whether you actually belong or do not belong to groups. But what matters is whether you strongly identify with a group or not. So social environment, not a maladaptive cognition. Ways of thinking, feeling, and behaving reflect pathology that resides not within the person, but rather within their social environment. So this means that it's not really person's psychology, person's mind that needs to be treated, but it is social environment that needs to be changed, that needs a cure. These manifestations are not so much a problem of the mind, but of the social world that structures the mind. And by social world, you may refer to unemployment, poverty, isolation, and stigma. So these social world makes people uh, difficult to join or stay in groups that they love. And because of loss of those social groups, people would have negative thoughts, feelings, and behaviors. Thus, as social psychologists, we really do not need to change people's mind, but rather we try to understand what influences people's mind, and then we should focus on those things in the society that have negative impacts on people's mind. Preventative intervention prior to depression episodes do not look like traditional healthcare, but require policy change and can be achieved at educational or occupational settings instead of healthcare settings. So, with a social identity approach, we really do not have to wait people to come to clinics or hospitals, but instead we can go out to educational or occupational settings so that people can learn how belonging to groups is important, and people can find groups that they love to join, and society that people can stay in groups that they love. So social cure involves creating social realities that empower individuals to restructure their own social worlds in ways that are optimal for their health. Okay, so yeah, so I think there are two ways. We really need to work on policy to change. Uh, we really need to work on uh, policy changes so that people have enough resources to join groups, and then also we can work on spreading the idea of how belonging to groups is important. So, as a conclusion of the chapter, depression is not just low mood or inactivity, but various symptoms that are caused by belonging, connection, and purpose. People may have depressive symptoms when they cannot belong to groups, when they lose connections with others, and when they lose the purpose of their life. And belonging to groups can give a sense of connection and also a sense of the purpose in their life. A comprehensive biopsychosocial approach is needed that emphasizes the importance of social factors as much as biomedical model and psycho model. Okay, interpersonal models. So yes, it is important to understand how our bodies function when we face stress, And then also it may be important how our mind works and how they influence our feelings. But we also need to understand how social factors influence our thoughts and feelings and also maybe behaviors. And then with the understanding, we can work better to help people in need. Important approach is not to make people not to feel certain ways, but to make people not to live in a world where feeling certain ways make sense. In other words, traditional psychology tend to focus on changing how people feel. When people have negative thoughts about themselves, then maybe traditional psychology tries to encourage them not to think that way. Traditional psychology tries to make them look at good points of themselves, or look at the good parts they have in their lives. But the true cause of making those people think that way is within the society, not within individuals. And there, I think social identity approach can help to change such social realities and then help people to live in more hopeful world. Okay, so I think this is the end of chapter 8. And in the next class, which is the last class of this course, we will work on chapter 15. Yeah, I think so. I believe so. Basically, the last chapter of the textbook. Okay, thank you very much.